Welcome to the special Superintendent's Webcast, July 28th, 2020. I want to welcome all of our superintendents, guests, members of various K groups, and our co-op directors. We have, of course, another full agenda for you today. You should have received the PowerPoint presentation in your, it's on the meeting invite, and maybe a little bit out of order on your slides as to how we're going to conduct the meeting. One of our presenters regarding contact tracing can't be with us until around 3 o'clock. So that's the reason for that issue. We, of course, will take questions throughout using the Go Soapbox, and that's on your screen of how to submit questions. And of course, have a final closing question and answer session at the very end for any other issue that you may have. And we do have a hard stop today at 4 o'clock. The governor will have another press conference today, as I understand it, at 4 o'clock. And I know we all need to be paying attention to that because we usually have information regarding education or other matters regarding COVID that impacts education. So Tony, I'll, without further ado, turn it over to you for a communications update.
Okay, I'm gonna go ahead and share my screen. Can you see my screen?
Yes.
Okay. All right, so we did update the agenda in here, and like Kevin said, Mark Carter will be available, but he'll be moved to the end of the agenda. So I'm going to start again with our KDE guidance documents. I did put a slide in here. We used this last week for our town hall, just to kind of show you again where you can find our guidance documents. This right here on the left is our home page. If you click on the blue, that will take you to our home page. And then the COVID-19 page here on the right. And then in the green is where you will find our reopening guidance documents. To date, we have released, I believe we're at 18 documents now, including the flagship Healthy at Schools document. All of those are listed here. As always, we update every week. You will hear today about 2 of those documents, the flexibility for assigning staff, and also the considerations for reopening schools for food service operations. Just a brief overview of our virtual town hall for educators and staff, which we held last Thursday. We want to give a shout out to all of you for sharing information about the virtual town hall. We had more than 3,000 people tuned into the event for the duration. And I believe as of this morning, we looked and there was more than 10,000 have watched it online. We are still working on answering some of the questions. As they're being answered, we are putting it into this link right here. As you can see, the COVID-19 answers to FAQs. You can find that on our COVID-19 page under the FAQ section, just under the green tab. So we appreciate all of the support and passing along to your staff and employees about that. And then I just wanted to remind everyone to make sure that you are keeping up to date with the governor's press conferences. They are kind of sporadic. I believe there is one today at 4 o'clock. You can always keep track via his social media pages. You can sign up for his updates on his website. They used to be every day at 4 o'clock. I'm not sure if they're going to go back to every day at 4 o'clock. But if you sign up for his emails and through the governor's office, you will usually get an email in the morning that will tell you if there is going to be a press conference, and you can watch those via Twitter, Facebook, and via his YouTube channel. So just wanted to keep you up to date on those because obviously with the numbers rising in COVID, it is a good opportunity to hear any updates that will be coming from the governor's office. And with that, we'll turn it over to Dr. White and Dr. Meserly.
Hi, everyone. Dr. Meserly and Dr. Meserly and I and folks from KDE, especially Angie McDonald, have looked over our Healthy at Schools document in light of the updates that happened late Thursday evening from CDC. We looked at some of the changes that we thought might be appropriate for our document. We said from the very beginning that our Healthy at Schools document, the flagship document, was a fluid document because we only know what we know when we know it. And as we learn new things, we want to be sure that we are giving you the best and most up-to-date advice. When we first started our conversations, we talked about plexiglass dividers. Advice that we received at that time were that this would probably not be the best idea for students and for safety. Since that time, with the Department of Education, we have met with safety folks, we have met with the state fire marshals, and have decided that for folks that wanted to put plexiglass dividers between students, where environmental staff from local health departments and the school fire marshals agree that this is appropriate, that they're fastened securely so they don't fall over and hit anyone in the head. What I didn't add here, and I should have put this in the document, was that we wanted to make sure the edges are smooth and beveled. We don't want sharp edges. And we want to be sure that those are clean, just as when a student cleans their desktop. But we're allowing for provisions for that because that seemed to be something that people really felt like was very appropriate. And so we did make that a change in our thoughts. The CDC document talked about, as we had talked about in the past, about a 72-hour with no fever. That has been changed across the board. In the old documents, it had to be 72 hours, and now that's been changed to 22. My personal gut feeling as a physician, I like 72, but we can't make state policy by Connie White's gut, so we're going to go with the evidence that CDC has brought to the forefront, and so it is now a 24 hours with no fever and no fever-reducing medications, and also going back to the policy that you already had for illness. When a child leaves school with a fever, they have to be 24 hours without fever-reducing medication. We had made that 72 earlier, and now with our revisions, we're making that 24 hours. And we also just wanted, for clarification, we wanted to add that a note for a negative test would not be required for returning to school. And I know a lot of people have talked about wanting to get that negative test, and that is not part of the non-testing strategy that Kentucky has used since March. We have not required people to have a negative test, and we think that would be an extra burden for students and for the family. We also wanted to change in our list of symptoms. We had talked about if you have a cough, and one thing that CDC was very clear about is by doing that, we might be causing a lot of students and faculty and staff who have chronic cough because of asthma conditions or whatever health condition, they would continually be excluded, and that was certainly not the point. So the recommendation was to change it to new uncontrolled cough that causes difficulty breathing. And this way, we will be sure that we are not penalizing people with a chronic condition to always have to go through that every time that they're dealing with those exclusionary categories. So I hope this is clear. We're putting this together as a one-pager. I did not have time to get that to Kentucky Stats, although I think Tony has done a lovely job with this slide here. But we did want you to, we will make the change, but we felt like it was important that you have a one-pager so you're not searching through the document trying to figure out what's changed and what hasn't. These will be the changes that we've decided to institute, joint decision between Kentucky Department for Public Health and the Kentucky Department of Education. So I'm happy to answer questions. I'll be around for the rest of the day. I may have to hop off about 3 o'clock, but I will be back on because I want to be here for Mr. Carter's presentation on contact tracing. And I believe, Tony, that was the only thing that we had sent you. So I don't know if you want questions now or later, and I'll be around for however you want to go forward. Dr. Messerly, did I leave anything out? I think she's on here somewhere.
No, thank you very much. I think that's the most important. And And then we will be sharing, there is a really good infographic related to symptoms of COVID that kind of mirror other illnesses, but so that school staff and school nurses can kind of have a checklist to help differentiate between colds, flu, asthma, strep throat, different things. There's a really nice one-page infographic that I shared with KDE that hopefully they will share with everyone that really helps just to minimize exclusion of students who may have other illnesses that are not COVID.
Great point. Thank you.
Yes. So I'm not sure if we want to go and answer. I mean, I can go to the soapbox. There are a couple questions in here, and we will get this out to our superintendents. Our plans right now is to kind of issue this as a one-pager with the graphic and kind of attach it to the front of the Healthy at Schools document as a revision with today's date on it. So that we don't have several documents floating around, and this will happen every time that we revise the document because we do have it in several languages as well. I think that would be the quickest way to do this. So we are going to work with KY Stats to get that out and also get this out to our superintendents in our districts today as well. So, but it's hot off the presses. We just got this out for you all for the webcast, and so just give us a little bit of time and we'll get that out to you. And I'll go ahead and ask a couple of questions since I have both of you on right now. The first couple of questions that are here is about regards to the plexiglass. The first one is if there's a plexiglass separating students, 6 feet of social distancing. Their question is, does the 6 feet of social distancing have to be maintained in order to remove a mask?
Yes, I wouldn't think that, and get Dr. Meserly's opinion, but I wouldn't think that plexiglass is going to be equivalent of a 6 feet separation. It's not going all the way up to the ceiling. I think that it's just an extra layer of protection, and we've talked about from the very beginning the Swiss cheese model. The more layers you put on, the more level of protection. So the plexiglass would not be in place of the 6 feet separation. It would just be one more protection you'd be providing for your students.
Okay.
Correct. And one of the places where we're seeing suggestions for using the plexiglass is in those classroom settings where the students either are of a young age where masks cannot be worn or it's difficult to keep masks on, or in the special needs population. So we don't want plexiglass to be used in older children just to fit a whole bunch more kids in the classroom. We still need to have masks on and 6 feet as much as possible. But those plexiglass can be helpful for students who can't wear a mask or have trouble wearing a mask.
Okay. They're saying six feet spacing when students, well, it looks like the meals, well, this can be a little bit later. This is not on the new, different. They're wanting to know if the temperature check guidelines are going to be changing.
No, that's not part of the revisions.
Okay. The next question on the kind of rephrasing about the plexiglass. Can there be any additional flexibility with the social distancing and the masking at all?
No, I agree with Dr. Meserly. I think it's a layer of protection, and especially for those younger kids or for kids who you think are not going to be doing their masking as religiously as we would like them to do. It's just an extra level of protection.
Okay. All right, and I think that's all we have on the changes to the document at this point. So we can go ahead and move to the next.
Tony, before we do that, since we're running ahead of schedule and while we have both Dr. White and Dr. Meserly here, I want to just give a brief update on what happened over the weekend. and some of the superintendents have heard me speak to this in LSAC or during the task force. But as you all know, Dr. Birx, who is a member of the White House COVID-19 task force, you've seen her on TV beside President Trump and with Dr. Fauci. She came to Kentucky on Sunday, and I was able to be in the meeting with, along with Dr. White, other members of the cabinet, and public health, of course, the governor, members of business and industry, and also some representatives from University of Kentucky, University of Louisville, and others. Dr. White was not just coming to Kentucky just to be nice. She was here because of the concern that we are having in the state, and a serious concern in Mid-South states, as I've been referring to them: Ohio, Midwest states, Indiana, Virginia, West Virginia, and other states. She traveled to over the last few days because some of the data coming out similar to data that Arizona, Texas, California, Florida saw several months ago before they really hit a large outbreak. And so her visit was to remind us of the nature of this: an increase in cases or increase in positivity rate of greater than 5%, asymptomatic carriers. We're right in the middle of the state, which is great and to our advantage in normal economic times, a day's drive of 3/4 of the population, but that also brings with it folks traveling through here and folks in Kentucky leaving to go to Tennessee, the Smoky Mountains, the coast, and all over, and coming back home, and unfortunately bringing the virus with them sometimes. And so all of that is acting together to put us in a place where we're seeing an increase in cases, and we really need to be on alert. And so that was the reason for her visit. And she also had a time for us to provide feedback to her. I shared with her the need for consistent messaging at the federal level, and also some comments about some comments that have been made about at the federal level about tying funding to whether we're going back to school or not, and that was really not helpful in a time of pandemic and when we were all trying to act in good faith. Dr. White gave a great shout out to all of you out there for the work you've done, and apparently we've been good students of public health. She said she would give us, I believe, an A on our exam for our intro to public health. And so I really appreciate her sharing that, and the feeling is likewise towards public health. We've learned a lot, and I appreciate that relationship. So I wanted you all to understand that Dr. Birx coming to Kentucky is a sign of concern, and as you've heard the governor say, and with the additional measures put in place of closing bars, reducing restaurant capacity, and of course mandatory masking, we are hoping that the numbers will start stabilizing and coming back down so we can get back to in-person classes around August 17th. That's the hope, the desire of everyone at every level of government in Kentucky and in the business and education sector. So I've talked with several of you today. I know it's frustrating. And I know many of you are advocating for some districts to be able to go to in-person while others not because of the cases. And just know that because of the demographics of Kentucky, while we are somewhat of a rural state, we are not a remote state. And so we have a lot of crossover from community to community, and many of the teachers and staff members in your schools don't necessarily live in those same communities. They may be traveling an hour at a time to get there. All that factors in to the reason why the governor made the recommendation that we hold off on in-person classes until the third week of August. I think it's everyone's intention that we be allowed to then start implementing our in-person plans at that time. However, we all know this is changing. If these numbers keep going up and do not stabilize or go down, we are getting into a very concerning state of affairs. And so I just want to make sure that I want to reiterate what the governor was saying on the press conference. I was in that meeting, and I could hear the concern in the voice of Dr. Birx. And she was a very sincere, very down-to-earth person, not political at all. So down to earth that if you were at the Frankfurt Walmart on Sunday and you thought you saw somebody that looked like Dr. Birx, it was her. She was at the Frankfurt Walmart trying to find disinfectant wipes because she can't get them in D.C. So I was very it was good to meet her and interact with her, and I felt comforting in a way. It was comforted that someone of her caliber chose to come to Kentucky and share with us, but also concerning with the message that she had to share. So I wanted to share that with you. I also know that many of you are asking that if we get to a point on August 17th or after, that there may be, if there were another recommendation, that you be allowed to at least implement in person at a certain percentage, maybe a hybrid plan, maybe only bringing in, if there was still concern of in person, maybe allowing you to bring in 25 to 40% or so of your, because many of you have plans for that as an alternative. I will share that with the governor, and public health folks are hearing that right now. We will certainly take that into consideration. We're hearing you loud and clear, but just know that these decisions are being made and recommendations are being made based upon the evidence, the data that we have at this time, and in order to prevent and not get us to a place that the other states to the south of us have seen. We all know that we're trying to prevent an increase in cases getting into our hospitals and overrunning the healthcare system. That's what we want to try to prevent. So, Dr. White, did I pass that test?
Yes, I think you get extra credit for that.
So I thought I just wanted to share, Dr. White, I don't know if you have anything else to add to that. I think it was important in sharing that conversation this weekend. I think it was a very important one, and I want to make sure the school districts understand the seriousness of the situation.
Well, it's interesting because I'm going to be doing an interview with a high school class in Louisville, and they sent me a video of the last person that they interviewed, and this was back in April, and it was an ER physician in Louisville. And he said, 20% of people with COVID-19 are asymptomatic. Well, that's what we thought back the first week of April. Now we know that that number is closer to 40, maybe 60%, and some people even project higher. That shows, just as we're revising our Healthy at School plan, it shows that we are continually getting new information, new studies, new observations, new guidances that we need to reach out to you folks so that you understand things are changing. The virus isn't changing, but our understanding and our interaction with it is. And I agree with Dr. Burks. I'm very concerned about the number of 20 to 30-year-olds and those numbers. That was the other piece that she said, that they had seen all of this along the coast, and now they have an exponential rate of cases. And they are very concerned that if you look at the map and it's all red down around the Gulf of Mexico and Arizona, they're concerned that red is just going to move up from the south and overwhelm Tennessee, Kentucky, Indiana, Ohio, and Virginia. And that was the mission she was on the other day.
Very much agree. And another thing I just read, and I haven't had a chance to discuss it with you, Dr. White, I just read an article over lunch that I believe there are around 303 cases in Florida of K through 12 age students that are in the hospital due to COVID. And so we've heard this narrative until now about, well, they may be carriers, but they're not getting the illness, or they're not showing symptoms, or it's not serious. And then now we're seeing, at least in one report that I read, that we do have some hospitalization of students. And so this is another reason why we have to be very vigilant, very cautious, continue to evaluate the situation on an hour-by-hour and a day-to-day basis. So I wanted to provide that to you, superintendents and others, just so you know what the thought process is here at the state level, and that we are taking what you are giving us as feedback into consideration, but also have to factor in all the other things that we're learning from CDC, Dr. Burks, and others. Tony, Dr. White?
Not to be all gloom and doom, but we can look at other countries and we can see they have brought this down. They brought their case rate down, and it's with just diligently with the face masking and finding people as quickly as we can that are positive and separating them from others so they don't spread it. I mean, if we can do that religiously, we can see those numbers go down. We can see them go down as quickly as the 17th of August. This can be done, and it's up to all of us that understand the science to be able to share that with others. So thank you for being so open to having us jump into your party every week. We appreciate it.
Tony, any other questions, or do you want to move on?
There's a couple more here that I think we can get at pretty quickly. One is, if a student is removed from a classroom with COVID-like symptoms, should there be a protocol in place to remove students from that same classroom for a certain period of time for cleaning, in parentheses, 24 hours?
Okay, to make sure I understand, so a child starts to have symptoms in the classroom, you remove that child, send them home, then what do you do with the other children around them? Is that the question?
Yeah, should there be a protocol in place to remove other students from that same classroom for a certain period of time?
I wouldn't think until you had a positive test that you would necessarily do that, because otherwise, that, talk about disrupting things, that would be most disruptive, and you would be disrupting things on a maybe little Connie has COVID. So I think you would want to wait until you had a positive test result before you did something like that.
Okay. All right. Another kind of health-related question. Let's see. Is there an update on the requirement that employees self-assess and take their temperatures at work rather than at home, which is allowed by the governor's Healthy at Work guidance?
I don't know that we changed that. I mean, at my workplace, I get my temperature taken when I come in every day, and then I have to turn in my assessment of my symptoms with my payroll when I enter my hours. But I don't think we changed that with faculty at schools and staff at schools. And so help me if I'm wrong there, Dr. Meserly, or maybe I'm just not understanding the question.
No, unless KDE submitted their own guidance. We haven't said that staff have to monitor at school. No.
I think
there's a little bit of confusion between the Healthy at Schools document that may suggest that when students are present, staff actually have to have a temperature check on school premises versus the Healthy at Work guidance that indicates staff can take their own temperature, prior to arriving at work. So I think there's been some question around that.
Thank you, Todd. No, Again, I'm looking as if I were a principal and I was in charge of that school and those children, I would want to see everybody's temperature being taken, whether you're delivering something to the snack machine or you're working in the cafeteria or you're the school nurse. I would think that layer of protection, again, another layer would be important to check those temperatures. You don't have to record the number. You just need to know that that person has been checked and that they are afebrile.
Okay. With the current travel advisory, should districts enforce mandatory quarantines for athletes and staff members who have traveled to a state with 15% positivity rates?
That is the governor's recommendation.
Okay. And then we'll go with one more. Is there a target date in August that districts can expect to know if the request to begin with NTI would extend beyond August 15th?
Well, we obviously know the sooner the better for districts, but we also know that we're trying to strike that balance of not putting those restrictions on too long, but then we have to give enough time, a 2-week period of time roughly, to start seeing results from these mitigation efforts, the reduction in restaurant capacity, the closure of the bars, the masking, etc. And so there's a sweet spot there. And so we understand that more time is better for you. At the same time, we want to make sure we start realizing a reduction in the cases. So if the governor's press conference today or tomorrow starts seeing a reduction, that's a good sign, and then another reduction the next day, that's a great sign. If we start seeing holding of where we are or increase, then that's probably looking like we're going to have a longer period of time before we can make a recommendation about the middle of August. That's at least would be my interpretation. Dr. White, Dr. Meserly, do you concur?
Yes. I have just one additional comment to make for how superintendents and teachers can be leaders in their communities. We will not be able to open schools or have some type of partial in-person attendance unless your community as a whole is really respecting the guidance that's coming from the governor's office. So the more that the messaging from your school board, your teachers can communicate to parents that if your community wants to have their children in school, then the community needs to step up as a whole to take the measures, to wear the masks, hand washing, to perhaps do the online church service, but that it's a community effort to get the children back into school.
Okay. All right. So I know we'll have some more questions for Dr. White and Dr. Meserly, but we're going to move on to our next item on the agenda, which is going to be with Lauren. And let me see here. Hold on. Let me get to my PowerPoint.
Catherine Embry, I believe, will be joining.
Yeah, Katie,
Lauren Moore.
Katie and Lauren, are they on?
Yes, I'm here, Tony. It's Lauren.
Okay, good deal. I'm getting to the website. There we are. Katie, can you hear us?
Yes, I can hear you.
Okay, good deal. Just wanted to make sure you were both on. All right.
Thank you.
You all are good to go. Just let me know when to advance.
Will do. Thank you. Good afternoon. Happy to be here again with you all to discuss additional food service guidance that we've recently released. And this is the guiding question that's been posed for consideration to our advisory groups. What supports can school and community nutrition provide to assist school districts with remote food service for the upcoming school year? Next slide, please. You all will remember that in June, the Division of School and Community Nutrition released guidance that addressed food service operations for students who would be attending in person in your school buildings. Shortly after that release, the United States Department of Agriculture released nationwide waivers that allow districts to feed students who are learning through other methods, remote, virtual, non-traditional instruction. In response to those waivers, yesterday we released a guidance document that focuses on these waivers. Next slide, please. The waivers granted by the USDA, one back, please, Tony, sorry. Thank you. They are effective through June 30th, 2021. Katie will be going over those in more detail, but before we get to that, I want to point out, and most of you have probably heard from your food service directors, these waivers are a substantial change from the way food service was, meal service was distributed in the spring in mid-March when schools went to non-traditional instruction. In the spring, the USDA gave sponsors the authority to provide meals through summer meal programs. Those programs provide meals at no cost to children ages 18 and under. And the meal programs that the USDA has currently given authority for us to administer are the school meal programs, which are the National School Lunch and School Breakfast programs. Those programs are the programs school districts are used to providing meal service through the school year to their students. It is only provided to enrolled students, and the cost of meals is subject to eligibility of the students. And that is for schools that do not provide meals at no cost to all students through CEP. So those typical eligibility status, free, reduced, and paid, will come into play in your non-CEP schools for the upcoming school year. One thing I want to explain here, of course, as we've said throughout, this is all subject to change. We are aware and understand that this is creating substantial challenges for food service departments as they are trying to feed students in a non-congregate setting. There are many organizations currently advocating for additional flexibilities to mitigate these challenges. And of course, we're all aware of the financial hardship that it's placed on our food service departments. We at KDE are very supportive of additional flexibilities and options for school districts, and we are currently working to submit statewide waivers to the USDA in an attempt to lessen these burdens. These waiver requests will be posted once they are submitted. They'll be posted on the KDE website. We will also distribute them to the food service directors in your districts through our normal communications that we send to them on Mondays. We will continue to communicate any new information we have as it becomes available, including waiver approvals. Next slide, please. So, as I said, today we'll be talking about where we stand now for the upcoming school year and the flexibilities that we have. So, which child nutrition programs you will be using for NTI meal service. We're going to talk about 3 different areas. The first is a planned school day, and this is when there is in-person instruction or NTI provided, and the day is counted as a school day on the calendar. Those meals will be provided through the National School Lunch Program and the School Breakfast Program. For a planned school closure, so no instruction takes place at all, the weekend, including weekends and holidays, no meal service would be available, and that's our typical situation in a typical school year. And then our third option here, unanticipated school closures, or our third scenario, is when you had a planned school day, but it's canceled due to a qualifying event. So no in-person instruction or NTI is provided. We have submitted that question to the USDA to get further guidance on if a school district has the planned school day and that planned school day has to be canceled because of coronavirus, would there be able to be some type of food service? So we will send that information as soon as we get this, get a response to that from the USDA. And so at this time, I'm going to turn this over to Katie, and she's going to talk a little bit more in detail about the waivers.
Thank you, Lauren. Next slide, please. So as Lauren said, we will be ready to change course and provide additional guidance if the USDA provides additional flexibility. But at this point in time, this is what the current regulations allow us to do. The waivers do not allow schools to serve meals through community feeding program models, as was allowed at the beginning of the pandemic in the spring of 2020. And unless specifically addressed in guidance, the program requirements of the National School Lunch and School Breakfast programs do apply to meals that are served to enrolled students who are receiving instruction due to COVID on NTI days. Schools must notify SCN of the request to use their waivers and receive approval. Food service directors have this information already, and we are currently processing requests on a daily basis. Next slide. Today, we're going to talk about 3 different models that you can use to provide meals to students who are receiving NTI instruction. The first one is meal pickup services, and then there's also sending meals home with students and meal delivery service to bus stops or households. Next slide, please. Thank you. Meal pickup services. So first, let's discuss how this would work. Meals are picked up at the school and taken home by a parent or guardian. And if the parent or guardian picks up the meals, they need to have a waiver approved, a parent pickup waiver approved if the child is not present, or the meal is provided directly to the student. Schools must have a method if they're utilizing this model. Schools must have a method to count meals by the individual student, collect payments when applicable, and include internal control processes that would prevent the duplication of meals being served. Schools should use meal distribution strategies that maintain social distancing, avoid the formation of groups or tight lines. Best practices for this are like a drive-through style for meal pickup or staggered pickup times. Keep in mind food safety and sanitation standard operating procedures for cleaning and sanitizing services, hand washing, employee health should be followed by all staff distributing meals. Also, parents and guardians and students should be reminded not to come to the meal distribution site if they are feeling ill. The next model is sending meals home with students. So in this case, schools would provide meals to students during an in-person instruction day to take home for consumption the following day or days during non-traditional instruction. Again, schools must have a method to count meals by individual student, collect payments when applicable, and include internal controls that prevent duplication. Again, in this method, program operators must take into consideration food safety when planning meals that could be transported home by students. And finally, the last method that we have is meal service by school bus or delivery sites. So this is where schools would use their school buses on their normal bus routes to deliver meals, stopping there or delivering directly to a household. When delivering meals directly to households, you would need to have written permission obtained by the family or household prior to the delivery that's permissible. And also, you would need to have a process to, again, count the meals served to individual students and based on their eligibility. It's very important to ensure that duplication of meals does not occur and that meals go to enrolled students per their eligibility. Next slide, please. And finally, there are two specific questions that we've been asked frequently. The first one is, is a school district required to provide meals to students receiving non-traditional instruction due to COVID-19? Meaning, are schools required to opt in to the non-congregate and meal service times waivers? Do you have to do that? We do not have at this time a clear answer to this question. We have submitted it to USDA. We'll provide you information as soon as we hear back and we get a response. And the second question, Lauren's addressed this, but I want to reiterate it. Can the district provide meal services during unanticipated closures with no instruction due to COVID-19? And again, we are still awaiting this answer from USDA, and we'll give you further instruction when it's provided to us. So if there are any questions, we would be happy to answer them at this time. Thank you.
Okay. All right. So I'm going to go back to the soapbox on food. All right. So we have a couple on food services. Just an observation. It is imperative that food service has the waiver like last year to serve virtual students using summer feeding criteria. Is there any information on whether this will be allowed?
Again, I understand the challenges with implementing the school meal programs. We are working, I know there are a lot of advocacy groups who are advocating to go back to the summer meal programs. Our current, the current flexibilities we have are for the school meal programs, but we are writing statewide waivers in the hopes of being able to do something more similar to what districts were able to do in the spring. But currently, school meal programs are what the USDA has allowed.
Okay. All right. So this one is kind of, well, I'll just wait till this goes to the general Q&A because it's not really related to this. I think that is going to be it for this topic for now.
Thank you.
So you're welcome. If you don't mind sticking around until the end.
Absolutely.
Great. And then we will go to our next piece of guidance documents. Oh, wait, there wasn't a USDA non-discrimination statement. Did you want me to share that on your slide as well?
You can share it as you pull up the next one. It's just a requirement, but thank you.
Okay. There it is. Okay, so there's that. And then we will move on to our next guidance document. It's flexibility for assigning staff with the COVID-19 instructional setting. Rob Akers.
Thanks, Tony. Good afternoon, everyone. It's good to be with you. And I know that these are extremely challenging times for you as you're trying to put your plans together and assign your staff to make sure that you're able to meet the needs of all your students. I've been monitoring Soapbox, and I feel like we've got some answers for some of those questions for you today. And I have staff on the call with me as well to be able to help take some of these more specific questions that we may not be able to cover in this presentation. As schools and district leaders prepare to safely reopen schools, precautions to enable in-person instruction will necessitate flexibility for staffing and assignment of teachers. We've heard from several district administrators, several superintendents, co-op directors as well, because of the COVID-related safety standards and a variety of instructional scenarios. Administrators are going to face unique challenges in assigning faculty. Let me preface by saying that as a former school administrator who worked with hiring and assigning staff for nearly 20 years, getting all the courses and classes staffed was challenging even prior to COVID. So just know that we understand that we've never planned for this kind of an event for hybrid learning or potentials of social distancing in classrooms, and we want to help to try to provide the best amount of appropriate flexibility that we can so that you can meet the needs of your teachers and kids while keeping everyone safe at school. So our goal in today's presentation is to share the flexibility that already exists within the regulations with the EPSB. And from what we've gathered, there are three main scenarios that you'll be facing potentially when you return to school. And that is just straight up in-person instruction, virtual instruction, and the proposed hybrid instruction. And with each of those scenarios, there are some unique situations that can arise that are going to need some flexibility, I'm sure. So before we get started, I just want to thank a few folks in my office, a branch manager of certification, teacher educator certification, Crystal Horde, special counsel to the EPSB and policy advisor, Cassie Trueblood, and director of educator certification and preparation, Todd Davis. They worked very hard to pull these scenarios together, to look at the existing regulations, to talk to our stakeholders as well, to pull together guidance to help you as you are navigating these very challenging times. So we'll start off with one of the easiest scenarios, and that is if you're in a digital or virtual setting. As districts begin the 2021 school year, a variety of digital platforms are being considered throughout the Commonwealth. Though a teacher of record should be assigned to digital platforms, there is significant flexibility for who may serve as that teacher. And I'll give you an example. I had one district call and say, I've got a middle school teacher who has significant health risks and is not practical or safe to bring them back into the building, but we have a significant amount of elementary students at the intermediate level who are going to work online. Can that teacher, even though they're not certified for elementary, provide that service as a facilitator? And the answer to that is probably yes, if you're using a digital learning provider such as Apex or Edgenuity, Odysseyware. Any certified teacher can provide that kind of content and facilitate that course if they're not creating that content specifically outside of their area. It is important to know that the teacher of record cannot be a substitute teacher, nor can it be an instructional aid. It has to be a certified teacher. However, it can be any certified teacher as long as the content is already developed and is being provided through a digital learning system. Next slide, please. So as we look at teacher of record and additional instructor, this speaks very specifically to some of the questions that are on Soapbox right now. And this, I think, is going to become a potential recurring situation at middle and high school, especially as you are in the hybrid setting. So as you comply with social distancing guidelines, it may require a class of students to be separated into multiple classrooms. Every course has to have a teacher of record who's been assigned the lead responsibility for students learning, but an additional instructor can be assigned to support and assist with instructional learning in collaboration with the teacher of record. So let me give you a possible scenario, and I'll give it to you from my high school world here. So you've got a high school with one physics teacher, and you've got 30 students who are signed up for that class. You have 5 students who have chosen to work from home virtually with the class, but they're learning synchronously with the class. And you've got the ability to only put about 17 kids in a classroom due to social distancing expectations. So you've got 8 leftover students. What do you do with them? Well, this is the perfect scenario for where you can have the teacher of record, but then bring another teacher in to provide support in another classroom for those 8 students. I know that that is probably not the best scenario that you've got, but you at least get to use a teacher who is in your building, who understands and knows the kids and your processes, probably already has hopefully a good relationship with the teacher of record. Potentially you've got someone even in the same content area. Maybe it's a biology or a chemistry teacher who can provide some support with that as well. So that flexibility already exists. So just to quickly go through the bullets, the teacher of record must be certified to teach the content and the population of the course, but any certified teacher can serve as an additional instructor. And again, I think this is going to be a really good method of trying to address some of the scenarios that have popped up in Soapbox around the social distancing requirements that may have you having to use multiple rooms to instruct your students. Okay, next slide, please. Superintendents, you probably are very aware of this, but course permissions, many certificates give some broader abilities to teach additional courses. A couple examples are listed on this slide. You've got elementary, middle school certified teachers can teach reading in all grades. And that's news to me. I didn't know that before we got into COVID. Middle school math certified teachers can teach algebra up to 11th grade. And middle school science teachers can teach intro to chemistry, physics, integrated science, and earth science at the high school level. So those are just a few examples. We do have a link, a hyperlink in the presentation to the certification reference guide. Crystal Horde, our branch manager for educator certification, can quote chapter and verse of this to you, as can our other certification specialists, and they'll be happy to work with you individually as the need arises with that. Okay, next slide, please. We've received quite a bit of interest in the ability of allowing teachers to teach up and down grade levels. Currently, there's not a ton of additional flexibility here, but there is some that exists. So let's just go through that real quickly. Your elementary teachers with the grades 1 through 8 certification can teach all subjects up to 8th grade. So that does give you a little flexibility across the content area if need be. K4 and P5 certificates can teach up to 6th grade if the 6th grade is housed in the actual building of the other grades listed on the certificate. You've got middle school teachers with the 5 through 8 certification that can teach 4th and 5th grade combined and can teach certain courses through 9th grade. And your secondary teachers with the older P&S certification codes can teach down to 6th grade if the 6th grade is housed in the same building as 7th grade. And we do have some districts around the state who have some different configurations for their schools and may have had to apply for waivers in those cases, and there has been some precedent for that set. Again, please reach out to us and let us know so that we can work with you if you have some need around that area. Next slide, please. So the HQ certification goes back to the NCLB days where we had to have so many of the teachers meet highly qualified criteria. And this is one I think that'll be pretty useful, especially in light of an EPSB waiver that is already in effect that I'll get to in just a second. But it permits the areas of English, math, science, foreign language, social studies, health, and PE to be added for teachers holding correlative certificates. It can be used to add middle or high school certification or extend a middle school certificate to high school. 1-year certificate option for fully certified teacher who meets requisite points except for successful completion of the praxis, and that's the waiver that's currently in effect. At the April meeting, the EPSB suspended the requirement for successful praxis assessments because of the closures of ETS that made it impossible to take those tests. So for the next year, that waiver still does apply for those going through the HQ certification. Secondary teachers with major in the content area can extend their certificates down to add 5 through 9 certification within the content area without points calculation or completion of the praxis. So the teacher must submit an application verified by the superintendent to the certification branch. And again, that's Crystal Hord's crew, and they will work with you one-on-one for sure for that to help you and assist you through that process. Next slide, please. This is one that should be pretty familiar to you, especially this time of year normally, as you are trying to line up emergency certified teachers. If a district needs a teacher to teach out of his or her certification area, the district can request an emergency certificate for that teacher if there are no other qualified candidates. And the emphasis on this slide is qualified, and that is a district decision which candidate is most highly qualified. There are some other certificates out there that or other routes that specify that there must be a certified person for the position. The emergency certificate does not require that. So just keep that in mind as you're looking to try to fill some of these spots. 16 KAR 2120 does limit an educator to 1 emergency certificate. If the educator previously held an emergency certificate, the district could, however, request a waiver from the Education Professional Standards Board for issuance of a second emergency. So please know that that flexibility exists if you already have an emergency teacher in place and you want to hire them again for the next year, or if you've had one who served once before and you wanted to bring them back from working a couple years ago, you can still apply for that waiver, and we'll help you prepare that to take to the board in August. All right, Tony, next slide, which gets us to the questions, if there are any that are out there specifically or feedback on these. Just know that, oops, looks like I skipped a slide. Just know that we realize that all of these scenarios that we brought up in the existing regulation may not meet every scenario that you can apply to your district. We'd ask that you reach out to us individually. Please help us help you so that we can determine if there is some additional flexibility that does exist in statute or regulation, or if we need to work with you for a waiver that demonstrates exceptional circumstances. Just wanted to say thanks to our folks that we've been working with Jim Flynn at KASS, and with Eddie Campbell and Mary Rubel over at KEA, and we worked with some folks in some neighboring HR departments and districts to really try to look at what are the biggest concerns that are out there, what are the biggest needs, and what would the best flexibility be to help support our districts. Just know that we support you in the work that you're trying to do to get all of your students in front of the best teachers that you can. And we know that teachers will step up and try to fill those gaps because that's what they do. We just want to make sure that it's done with the appropriate guide rails to protect everybody. All right, then we've got our contact slide there, I think, Tony. And so embedded in the presentation, we've got links to Crystal Hord, who's our certification branch manager. A lot of you superintendents probably know her on a first name basis. Todd Davis, you've probably worked with quite a bit, and I'm on there as well. So please feel free at any time to reach out to any of us, and we're happy to answer questions or work through scenarios with you.
Okay. All right, so we can do one of two things. Kevin, it's right at 3 o'clock, and I know that our next presenters have joined us on contact tracing. So we can either go to questions for this guidance, or we can go right to the contact tracing and just do the rest of the questions towards the end. And do you have a preference?
I know Mr. Carter has a tight schedule and his staff, so let's just go ahead and go to him for contact tracing, and then we'll take all questions upon the conclusion of that presentation.
Okay, sounds good. So Mr. Carter?
Thank you, Tony.
Okay.
I think that, okay, there's my slides. Thanks everyone for having me on. I know this is the second time I've had the opportunity to speak to the group. I think when I did the first time, I had just come on board, and I think it was more of the governor's introduction of me. So I'm happy to report that we've made quite a bit of progress with contact tracing, and I thought I would step you through that a little bit. I'll start before I move through the slides with just a quick overview. I think I reported the last time that we had really three areas we were working on. One was the implementation of a system to support a number of tracers that would be deployed around the state. That system is now deployed. It's in various stages of being adopted in the health departments across the state. And by the end of this month, I believe it will either be operating in every health department or close to every health department. And so that's been a successful endeavor thus far. The second thing, and probably the most important, is just this is a human resource intensive process. We need qualified staff, and we've made good progress there. When I first came on board, or really before COVID arrived in the Commonwealth, we had about 430 people or staff members in local health departments across the state that were doing disease investigation and contact tracing. Their focus, a historical focus, had been on things like HIV and substance use disorder, a little tuberculosis, things like that. And they were busy folks, believe it or not. And but since then, we've more than doubled the staff that are working on contact tracing. We've added, there were about 430 when we started, and we've added about 430. And we can add another roughly 260 or so to get to a full complement of tracers that would be in the neighborhood of 1,100 people. And I suspect by the time school starts, we'll likely be close to that number. And that's important because, as you know, the virus has been spreading rapidly. And while we've stayed ahead of it thus far, our ability to continue to stay ahead of it depends on having the right staff in place, in addition to things like social distancing and wearing masks, and really every citizen of the Commonwealth doing what they need to do to battle the virus. So, and then lastly, our communications effort. I'll talk about it a little bit more in a minute, but I think we've certainly spent a lot of time and creativity in developing effective communications around what we're doing with contact tracing. And I've got a slide on that I'll share with you in just a minute. But just to start out from the standpoint of school safety expectations, and I know that we also have Dr. White on the phone, and I believe Emily Messerly is also on the phone from DPH. But these are just some of the, on this slide are just some of the safety expectations that we have for schools. Obviously social distancing, and you know what that is. It's, I think the art that you have to deal with is just how do you do that appropriately by age group. But the idea of social distancing is something that's going to help us battle the disease. Cloth face coverings and personal protective equipment. Again, being ready when school starts to be able to make sure that students and faculty are masked, train them on the use of personal protective equipment, and that sort of thing. Screening in school in exclusion, just having a plan in place to screen for COVID-19 prior to school entry. We have kind of an analog system, frankly, at the CHFS building, where we have a checklist of the symptoms of the common symptoms of COVID that we just have to check off whether or not we have those or not. fever being, probably the most recognizable one. So having some kind of screening before school entry would be important. Isolation area for sick students. I think you probably have this generally now and when a student is sick, but the potential that you could have, you could have a busy exclusion area with COVID needs to be thought about. And then just exclusion criteria for staff or students if they, need to stay home if they're experiencing symptoms, and how to deal with that. Sanitation, just keeping the facility clean, and I think there's been a lot of communication on this, and I'm certain that this group's well aware of the needs in that area. And then lastly, and I guess the thing that I'm charged with from the state standpoint is just be prepared to work with the local health departments and their contact tracers, and in the investigations to keep accurate records. And I think this is one thing that you can do within the school in terms of you're great at keeping attendance, but for the teachers to know where their students are sitting, who's close to them, those kinds of things would assist in a disease investigation and a contact tracing effort. So Becca, if we can go to the next slide. This just gives you an idea of the type of questions that would be asked in an investigation involving a school. So these are some of the things we would look for: the name of the school, the teacher, the contact's name, email, phone, the grade of the patient, those kinds of things. And you can see the sort of the screenshot of what that would look like to the tracer. So these are this just gives you an example of that. So let's go to the next slide. We've been really concerned about fraud, and these are some of the things that contact tracers will ask. It's things like, where have you been the last few days? These are general questions. Names and addresses of contacts that were close to them. We will not tell any contact who caused the exposure, so we won't disclose the identity of the patient to a contact. But those are examples of what we would do or the types of things we would talk about in a tracing call. On the right are the things that no one will ever talk to an individual about, either a patient or a contact. Anything related to financial information, Social Security. We're not going to ask about immigration status. And if an individual gets those kinds of questions, they should just terminate the call. Probably the thing to do is, if they suspect fraud, is to call the Attorney General Fraud Hotline and report the incident, and then call the local health department directly to follow up on their status. And then that, I believe, summarizes those comments. So if we could go to the next slide. These are just some of the materials for distribution. I think that some of these we had available when we talked the first time, but we've spent a considerable effort on communication around contact tracing. There's so much misinformation that goes around on the web, on social media, and so we spent a lot of time developing a set of frequently asked questions, explanations as basic explanations of what contact tracing is, how it works. We've put together infographics. We've had a number of prominent Kentuckians do public service announcements on contact tracing. And all of this is available to you for use in the schools. You can access most of this on the KY COVID-19 website. But if you need direct access to it, to the PDFs or those kinds of things, you can contact either the local health department in your community, or you can contact the Department of Health. And feel free to direct any of that you want to me. I'll make sure it gets to the right place. So that is is an overview of where we are on contact tracing. I recognize that hopefully it was a brief overview. And I think with that, I'll stop and we'll see if there are any additions any of my colleagues that might be on the phone want to provide or take questions. And Kevin, that's up to you as to how you would like to handle the question and answer session. I can stay on.
Thank you. Yeah, thank you. Tony, let's go ahead and if we have questions related to contact tracing, let's just go ahead and do those.
All right, so let me look here. We have, let's see if there's anything here at the bottom. Well, it looks like we don't have any questions right now on contact tracing.
Well, I'm happy to stay on, Kevin, for the Q&A session too. So whatever your pleasure is there. Yeah.
All right. If you don't mind doing that, we're into the Q&A session now. So it looks like we may be able to finish up a little early this week. So Tony, let's just start with some questions.
Okay. All right. So our first question at the top is going to be for Rob. It's going to be in relation to some certification. When will we know? Well, maybe it looks like. Well, when will we know CERS's decision on allowing a full year of service credit based upon hours worked instead of days? This info is needed ASAP, so we do not have to bring employees in next week. So maybe not Rob.
Kevin, I'll take that question. I think that's related to some questions that we received regarding the variable student instruction calendar and classified staff and how they would accrue credit in the retirement system related to that. So for example, if they worked fewer days, would they receive credit for a full year of retirement credit? We posed that question to Kentucky Retirement Systems and they responded back to us with a memorandum that they found to be applicable to the situation and told us that so long as those certified employees worked the same number of hours that they would under a traditional calendar, that they would receive credit for the full year for retirement purposes. As we have indicated, we cannot bind the Kentucky Retirement Systems, and we encourage any follow-up questions to be directed to retirement systems. But as far as I know, they have provided a final answer to that question. Any more particular questions really should be directed to them.
Okay. All right, the next question is how many regular education students could an elementary teacher, or in parentheses, middle and high school teacher, be assigned to monitor during remote learning / online instruction? If class size restrictions per KRS 157.360 are required, will a waiver be requested?
I think, Rob, that's you, but it also may go over into another area. Can you start us out?
Yes, I do think it goes into another area. I can say that I know that at the high school level, which is my frame of reference, we've had dozens of students who've been in credit recovery programs using learning platforms. And so that was not governed by a specific class cap. I messaged David Cook to see if maybe he had anything on there as well with cap size. Crystal, did you have something on that as well?
No, I've got the KRS book here. I was looking through there, but that's a pretty long statute, and in a matter of a couple minutes, I haven't been able to find anything yet. It's not anything I can tell. Certification has historically not had anything to do with the cap size of classes, the number of students in a class, regardless of what the instructional setting was. We just oversee the certification requirements for the teacher who's assigned to the courses.
Hey, this is Kelly. Is Marty Park on? I believe I've seen a response that he issued around it would be the same as face-to-face for class size.
That's what I was going to say, Kelly. This is David. To Rob's question, I think it's something that that Marty has dealt with.
Just mark that one for a response, and we'll make sure to get that in the sheet with questions and answers. But I do believe I've seen a response from Marty somewhere else saying it's the same as face-to-face.
That's correct. That's correct, Kelly. David Couch. That's correct.
Okay, great. Thank you.
And that's regardless of platform?
Yes.
I think somebody might be muted. We're good.
We are good. David said it's
Okay.
regardless of platform.
Okay, good deal. All right, question maybe for public health. Do you know how fast we are getting positive test results back? If it takes days to receive test results, what do we do with students in the meantime if COVID is suspected? Now, I believe, Dr. White, you had addressed this initially in some of our revised about not waiting for a negative test. But if you want to go ahead and maybe address this question. Or did she skip off?
She had to jump off for another engagement. She'll be back on. I don't know if Angie.
No, I'm here.
Oh, she is? Okay.
I'm here.
Yep.
I was just muted.
Okay.
So that's a really good question. I feel some days like I'm back in March of 2020 when we were first trying to get testing in Kentucky. And I was told by a very large national group that Kentucky was a low priority state because at that time, Seattle, Washington, and the Northwest was exploding with COVID. And so this national organization was sending all their reagents and all their swabs and everything, all their resources to the Northwest. Now it appears that these national organizations are sending everything down to the South and the Southwest. And so back when we were getting turnaround time of 48 hours, sometimes 24 hours in some of these organizations, some of these larger labs, it's now spreading out. And so you're absolutely right. Not finding out a test result for 7 days, there's a whole layer of problems that causes. Number one, if this person truly is infected, it is recommended that if you think you're infected, you should isolate yourself until you get your test results back. That's 7 days someone's being isolated waiting for that test result. And if it's negative, they feel like that's been a loss of their time. If they are positive and we haven't started quarantining their contacts, that's another problem for public health and for increasing the spread of the virus. And I wish I had a really good answer, but I don't. We are working at public health trying to get attention from these national organizations for our state. We're working very much, and we've been very blessed in Kentucky with a lot of locally grown laboratories. You've heard the governor talk about Gravity, Solaris, there's Wild Health, there's Deep Water, and I shouldn't have started naming because now I'm going to leave somebody out, and I don't certainly want to sound like a commercial for any laboratory, but there are laboratories in Kentucky that are really building up capacity to provide us with the testing that we need. So ideally for Mark Carter, for that contact tracing to work, if Connie thinks she's positive and she has a test, the quicker I know if I'm positive or negative, then Mark's team of contact tracers can now swoop in, make sure I'm in isolation, and make sure my contacts have been quarantined. So your question is a very good one, and I don't have a really great answer other than time will help these labs build more and more capacity so that they can do this turnaround time much faster. And I don't want to confuse people with that comment that I made earlier about a negative test. The negative test was if someone is COVID-19 positive and it has left your school facility, they do not have to have a negative test to come back into the facility. That's just a test that we need for someone who thinks they're positive. And the CDC has all along had a non-testing strategy that we in Kentucky have promoted. So you don't have to have a negative test to come back to school.
Okay. All right. Thank you for that answer. The next question, I can go ahead and answer this one, and I'm going to share my screen. I know that we covered this, or I covered this at the beginning, is the flexibility for assigning staff guidance a standalone document to be released to districts. This would be a helpful reference to have in hand. So the short answer is yes, this is one of our guidance documents, and I'm going to go ahead and share my screen so that you can see where it is located on our website. It is located, as you can see, on our COVID-19 website. Are you all seeing the COVID-19 website?
Yes.
And all of our guidance documents are here. And we issued the flexibility for assigning staff. As you can see, it's the second item. You click on it, and all of our documents will load when you click on them. And so there's your guidance document on that particular item. So all of our guidance documents can be found there. They're all listed in addition to all of the other things that we have issued. And you simply just find them by going to our homepage, the COVID-19 page, and then go to the reopening resources. So I hope that that will help people find where our resources are on our website. And I will go ahead and stop sharing my screen. If I can stop sharing my screen, there we go. The next question is, more studies about air conditioning are painting a murky picture. Our schools have several rooms without windows. What is KDE's advice?
Tony, this is Kay Kennedy. We have been working with the Department for Public Health and also the State School Security Marshal, Ben Wilcox. And if you have a situation in your building where you feel like you need to talk to Marshal Wilcox about a waiver from the restriction that you have a locked classroom door, please reach out to Marshal Wilcox. He is, as we speak, working on a process to address those concerns. And to the extent that what you would normally do in a situation where you might have concern about ventilation, we would encourage you to follow that same procedure. If you want to get an air quality expert in to evaluate your situation and provide that information to State School Security Marshal Wilcox, that would be great. But he is more than willing to talk to you about the situation that you have and to come up with a good solution for your facility.
Okay. The next question, this is going to go to some of the I think it's going to be for Todd, because it's going to be relating to PTO. If staff gets sick and uses up all of the PTO, then what happens when we get quarantined again?
In that situation, a school district would have a few options available to it. We expect that next week the Kentucky Board of Education will approve an emergency administrative regulation that grants the flexibility to school districts to grant additional emergency leave to staff based on procedures and criteria that they develop locally. So this could be the type of situation that a school district would utilize that additional paid emergency leave that they could grant to staff. Another option to explore would be, obviously, if the individual is sick and can't work, unpaid disability leave would also be another option that the school district could look into if there were no paid leave options available. We have provided resources out regarding the Families First Coronavirus Response Act, which provides for paid sick leave that's more limited in nature, but there's also some more long-term Emergency Family Medical Leave Act provisions in there as well. So there are a variety of options that are available to you. If you have more specific questions, I'm happy to talk to you and walk through those. Okay. We have provided, I'll note one final thing, sorry, Tony. We have provided out to school districts a guidance document maybe last week that walks through the various leave options that are available to school districts to utilize for their employees.
And once again, that document is available on that page that I just shared under the reopening document. So everything that we issue is available via those links on that page. The next question that we have is, in a hybrid learning model with room capacity already maximized, how should schools handle new enrollments / transfers that would exceed the room capacity guidelines for face-to-face instruction?
So I think that goes back to the guidance that we shared earlier in the presentation around the teacher of record and an additional instructor. Crystal, can you talk about what the process is to do that through Infinite Campus?
Yes, and actually I was on another meeting earlier today, and one of the options that is being discussed and recommended a lot is the blended learning model, or the blended learning instructional setting. There may be some options where if a class has to be split, and the teacher of record is in one classroom and another teacher that is a certified teacher is an additional teacher on the course, then there's collaboration that is expected to be happening between the teacher of record and the additional teacher. However, there was also mentioned that there may be some options where the teacher of record may be streaming remotely into the second classroom. And again, the model that you discussed in the presentation, Rob, about having the additional teacher attached to those core sections would meet the needs of those classrooms and that. And that way it also ensures that the teacher of record is the teacher who is providing the content expertise, even if they are not the teacher who is physically in the classroom with the students.
Thank you, Crystal.
Okay. All right, so I have a couple of questions on CARES funding for, I believe it's going to be Robin. So these two together, the FEMA webinar said that CARES funds lose their federal status once they go to the governor's office. So is CARES exempt from federal match? What about other federal programs, in parentheses, Title I, IDEA, 21st Century CCLC, for federal benefits? How is CARES different?
So many of you got to participate or had someone from your district participate in the FEMA webinar that was conducted. I'm trying to get my days straight, but I think it was last week. We have been in consultation also with the Office of the State Budget Director, and there's been some confusion around the CARES Fund, specifically as it relates to when we talk about CARES funds. CARES funds is the big umbrella, and it contains more than just ESSER and GEAR, which many of our districts are familiar with. CARES Fund also contains other packages of money that are coming to various entities, including the Corona Relief Fund, which is separate and apart. And there's been a little bit of confusion on the CARES Act and how that applies. When we talk about the match, in seeking clarification on that, it is my understanding at this point in time that the match is a 25% match that is required by the district in order to access those FEMA funds under the requirements that you've been speaking with our contact, Tracy Doyle. We're going to get something out to you in writing to make sure that that is documented for your information and for your use. But at this point in time, that is our understanding. So it is a little bit different than other federal funds.
Okay. And then the second question related to that I can see offhand is, can CARES funding be used to pay for any extra costs associated with unlimited emergency days, including extra sub costs?
CARES funds can be used to pay for salaries, including temps. We always caution not to think about that, not utilizing that for your recurring expenses.
But if they are related to the coronavirus and your needs associated with that, you can use your CARES Act funding.
All right. The next question. Earlier, Dr. White stated that 60% or even up to 80% of people with COVID are asymptomatic, and the CDC doesn't recommend temperature screening of students. What is the reason for keeping this requirement?
What the CDC does state is that 16% of children are asymptomatic. I was talking about the U.S. and population in general. So 16% of children are asymptomatic, which means, if I'm doing my math right, 84% of them have some symptom. And certainly checking a temperature is the simplest thing we can do before that child enters the building and could potentially start to not only cause an infection, but also create a contact tracing quagmire. That if you can find that child before they go into the building and put that child into an isolated position, then you can certainly help to prevent spread to other people in the building and to also get that child into care as quickly as possible. So we feel very strongly that this is still a necessary safety expectation from the Department for Public Health and KDE.
Okay.
I would just further add that the department fully supports that effort and Dr. White's explanation, and we fully support this effort in the schools. We also know it's a logistical challenge, but we also know that it's in keeping with what Dr. White said, is something we can do to reduce the spread of those that are showing that symptom. And we have, as a reminder, public health and state government able to obtain over 12,500 instant digital thermometers that are being distributed to local school districts through the area development districts. That doesn't take away the logistics of it. I understand that, but it is something that we need to do. It's also my understanding that we have various businesses and industry that are still and will continue to use the temperature check.
Okay. The next question is, wouldn't it be a better practice to have teachers take their temperatures at home and not even come into the school building rather than have the temperature taken at school? The observation is it's a little late to get a sub when the teacher is walking in the door.
Well, I certainly know plenty of people that I work with that take their temperature in the morning before they even come to work. So there's nothing wrong with the faculty member, staff, or teacher taking that temperature before they leave the house. But I think if I were the administrator, that extra layer of protection for me would be that I can verify that I did check this, the person walking into my building to be sure that they are afebrile. I think that's something that we'll continue to work with the Department of Education on that topic. So that is like everything else that we're talking about. That's a very fluid situation.
Okay. All right. When the district is contacted with a confirmed case, we have heard some districts sending out general communication to all parents, not just calls to those families that have members in close contact, in parentheses, contact tracers. What is the recommendation?
So was that saying that who was contacting all the parents in the school? I misunderstood that part.
When the district is contacted with a confirmed case, we have heard that some districts are sending out general communications to all parents. They're wanting to know, should they be sending out the general communication saying that there's a confirmed case of COVID? Or what's the recommendation on who should be sending out that communication?
Well, and that would be Mr. Carter. I mean, that's a contact tracing question, and how oh my goodness, I just saw that cat moving behind you and it kind of surprised me. Tony. I thought there's something wrong with Tony. So I would think that you as an individual administrator can make a decision on how you want to do that, but the whole point of contact tracing, the manifest we've asked you to keep, will help those contact tracers to do a much more surgical dissection of people that need to be isolated, people that need to be quarantined, and prevents you from having to have an entire school system shut down.
Okay.
Yeah, I would just echo what Dr. White just said. That is the objective of the tracing effort. I'm not aware of any guidance that's been, at least that I've seen, to suggest that the schools should or shouldn't do some sort of more broad notification around it. But that is how the contact tracing would take place.
This is Dr. Meserly. I just want to remind all staff and superintendents that that the notification of contact tracing, this is so it's a diagnosis, and you do want to be careful about, if you think about FERPA and HIPAA, what you're deciding to share with a larger group. So I would definitely think this is a conversation for, if there aren't specific guidelines that KDE has put out yet, that maybe your legal consultation department talk about how superintendents should deal with family communications when there's a positive case in the school. I think that's because HIPAA is an issue.
Okay. All right. Let's see. So there's a question about Fund 51 balances. So I'm guessing that is going to be a budget question. So Robin, Fund 51 balances are in real trouble due to the reduction in meals served and a loss of meal reimbursement funding. Are there any plans in place to address this issue?
For some districts, that's absolutely true. I think our best bet is continuing to advocate for additional funds for all of the extra challenges that our school districts are facing. We see another round of possible stimulus money coming towards school districts. Remember, you can also use your GEAR money to help with your food service challenges, as well as ESSER. But as we look at it, and someone asked me the other day, will there be enough money for local school districts with all the challenges that they're facing? And food service is one of those. And, you know, the unfortunate thing is the answer is I don't know, and I don't know that anyone knows right now, because we don't know when the end of the pandemic will finally conclude. So at this time, we all need to be advocates for increases in our funding, because food service is one of those that we are continuing to hear from some schools and districts that are having that challenge, even though they're trying to do the very best they can to continue to provide those services for their students.
Okay. The next question is, regulations require suicide training to middle and high school students by September 15th. Will there be an adjustment on this due to the current situation? If not, how would you recommend we provide this training and follow up with multiple students by September 15th virtually?
I'm not sure that we have discussed an extension of that. I will state, and I'll have others from KD to chime in, that the nature of that training is essential right now, and I know the person asking the question believes the same thing. I heard anecdotally from a superintendent today about 3 student suicides across several districts this summer. We know there are social emotional impacts on students because of this. We know that there are social emotional issues in a normal time. So whatever we come up with any flexibility, it needs to be towards providing that virtually and providing that as soon as possible when we get back into whatever delivery method we are in. Anyone else from KD want to provide more specifics?
Hey, this is Kelly. No, I agree with you, Kevin, and I'll put that at the top of my list. I don't know that we need to focus on pushing that back. As you mentioned, we just need to focus on what other options can we help you all come up with to get that to your students as soon as possible. So we'll definitely take a look at that.
And I know our peers at the Department of Behavioral Health, Developmental, and Intellectual Disabilities are always working with Dr. Kelly on that. So they'll be very excited to help in any way they can.
Okay. The next question is, if we use an emergency waiver for COVID purposes, will this utilize the one-time emergency certification allowed?
Hi, this is Crystal. If the teacher has never had an emergency certification previously in the past, there is no waiver needed. The district just files for the emergency certification through the normal process. The only time that a waiver is required is if the teacher's previously been certified on an emergency waiver or on an emergency certificate in the past that was either more than 50% of their teaching schedule, or if it was issued prior to February 15th of the school year. So if they have any questions on a second emergency, they are more than welcome to give me a call and I can look that up, because the districts can't always see if a teacher had an emergency in a previous school district.
Okay. The next question is, if a district has developed a plan based on available facilities and changes in scheduling to go back to person full-time with small cohorts of students, how would a hybrid plan help, and why would we be forced to do that?
I think that's in reference to what I mentioned earlier when talking to some superintendents, and this was in the talking about if there were to be a recommendation that we need to refrain from in-person classes for another 2 weeks, if we're not seeing cases improve or cases go down, for example. Some superintendents spoke to me today about making sure that the governor and others knew that there were districts that had hybrid models in place that did reduce capacity, and if there could be some type of an alternative permission for in-person classes, so long as a certain percentage of capacity was realized. So this, if that were to be entertained and be permissible, I think we could certainly also talk about other options. For example, that's if districts are fully utilizing social distancing and not fully realizing their classroom capacity, that could all be part of that. That is just a discussion at this point based on conversations with superintendents. It is certainly not something that we have heard from the governor's office that may be, or public health, a possibility, other than we obviously continue to have discussions with them about options that could be available to us on down the line. This is going to be determined by what happens over the next 2 weeks with the number of cases. So I didn't mean to open up a can of worms there, but I'm glad that person asked the question, because, there are other ways to reduce the number of students than just a hybrid model. So that will be part of that conversation to make sure that the governor's office, public health, others are aware of districts some districts being able to pivot over to that model.
Okay. All right, the next question is, if we have both remote and face-to-face school and remote classes are at a cap, then 5 more people want remote. How do you handle exceeding cap sizes when you still have capacity in face-to-face but not remote? Looks like somebody might be on mute.
This is obviously regarding the cap size again, and I know we had several answering that question. I think we do need to flag this one and have Rob, David Cook, and Dr. Park get together to flesh out the cap size issue. I know Dr. Park has issued a previous guidance, but let's make sure that we may need to add to that based on these questions today.
Okay, sounds good. We will flag that one for you. All right, yeah, there's another question, just wondering if their class size limits are in effect for virtual classes. And if that's true, it needs to be changed. So another observation coming in on that. So I think that's a good idea. All right, the next question, the 6-foot spacing when students consume meals may not be achievable, especially at lunch when we have to provide duty-free lunch to teachers. What are the consequences if we cannot create 6-foot spacing when kids eat their meals?
This is Dr. Messerly. So as a former school nurse, I know how crowded the cafeterias can get, and given that, or classrooms for that matter, given that you cannot wear a mask while you're eating, the physical distancing is really important at that time. It's really important. Talking about the layering, we've removed the masks. So the distancing while students are eating is something that we have to adhere to. You agree, Dr. White?
Yeah, yes, you're absolutely right. And so some kind of a different way to do it is going to have to be figured out.
Okay.
I think utilizing outdoor spaces for eating when the weather is nice, setting up tables, picnic tables outside would be great.
Okay. Another question is, does the no in-class prohibition until August 15th apply to summer school?
Kelly, we had that discussion earlier today. Do you want to comment on
Sure.
that?
So we have actually sent that question over to Dr. White and her team. They probably haven't had a chance to even see that. I sent it this afternoon. But the question that has come up is that the governor has made the recommendation that we do not start school until the third week of August. And we have some districts who are thinking about doing some intervention programs or remediation program with small groups of students in early August. So, Dr. White, if you can't answer that right now, we will definitely get that response before next. Well, actually, we'll need to get it out before next week because people are planning their programs. So, Dr. White, do you want to try to weigh in on that?
I'm not sure if Kelly Alexander is still on. I know she was on earlier. She's Dr. Stack's chief of staff, and I know she takes messages like this that we need guidance from the governor's office all the time. So I'm texting her right now about this issue, so we should have something for you by tomorrow on that. I know what I think, but I think I would much rather get the guidance from the governor's office as to what that intention was from his comments in his press conference.
Thank you, Dr. White. We will get that back out to you guys tomorrow through a superintendent email because we know that you can't wait until next Tuesday to finalize those plans. So we'll make sure that you get that information as soon as possible.
Okay. Just another observation and question on the CAP issues. Is KDE having communication with KEA regarding duty-free lunch and CAP issues? They would rather know that stance prior to classes starting and not after. So I will mark that one and put that with the CAP issues questions that we will follow up with.
I can answer that. We have had discussions with KEA just as we had discussions with all other K groups. And at this time, we've been asking districts to try to be creative as possible, that there were no plans to put the duty-free lunch or waive the duty-free lunch provisions. And so we are asking you to try to do the best you can. We also know you will have teachers that volunteer not to have their duty-free lunch. And so that is the current stance that we have right now. And that is based upon the fact that we are going to be asking teachers and to be doing a whole lot of things that they have not previously done in addition to their teaching duties, and then that a break, if they choose to elect for a duty-free lunch, is one that would be necessary, particularly in this time. We also know it is going to be a huge challenge for many of you to make that happen. So that is where we are on it right now. Additional feedback from you about logistics and trying to make that work as we get closer to in-person classes will be helpful to us.
Okay. All right, and then just another observation, I have to have the ability to have a virtual teacher monitor more students than what the class size says, because it will free up more in-person teachers to help with social distancing. So just another observation on that, that issue. And I think with that, we have cleared the soapbox queue on questions 10 minutes early.
I do want to reiterate, I know this is stating the obvious, but the question was a good example about summer school. I know some of you were already doing that already and providing those remedial services and to students, and that was certainly fine at that time based on where we were. If there is a change in that, I need you to know that's because we've seen this increase in cases. The case positivity rate has gone above 5%. Things that we had hoped would never happen, because up until now we've done a good job as a state of doing keeping the cases down. And so that is why this change is occurring. It's because of the numbers, it's the statistics. It is factoring in by increased travel over the summer. Dr. Burks made a comment during her presentation that they think they can trace a lot of this spread back to Memorial Day weekend, then on into the 4th of July weekend, on how this is going at the south, the spread in the south moving north, and we're right in the line. We've got I-65, I-75, and going right up the middle of the state. And so we're right in line for that. And that's why, unfortunately, we are having to make these adjustments.
Okay. And I've mentioned before, we had one rural county that had single-digit cases, and within 14 days, they went up to 73 cases, and they could hone it down to 2 large family vacations on the beach, a couple of birthday parties, and 2 churches, and that got them up into the 70s. And then, of course, those people had other contacts. So it can happen extraordinarily quickly, people traveling out and bringing things in and then spreading that throughout the community.
Okay.
I've also heard today from some superintendents, knowing that you're going to be having staff that are just going to go ahead and travel out of state. We know that there's free movement in our country, and we value that. That's part of living in a free society. But also encourage everyone to, while you can't change the behavior of individual employees and your community members, it's so important that we try to change our behavior and our things we may want to do, even if it's just for a few weeks. My partner and I recently canceled a cabin trip in August even though it was going to be in the middle of North Georgia mountains, we canceled it because of the governor's recommendation on quarantine, and we're making that sacrifice. We have a member of our leadership team here on the call today that took a trip for their anniversary to Lake Barkley this weekend instead of going out of state. And so I know that's easier said than done, and I know when folks have children, they want to have memories, and there's cabin fever out there, but it really is, even if folks are going and observing all masking and being as careful as possible, when you're going into a hotspot area, you are increasing your risk, and then that could possibly come back with you. So that's just my own personal public service announcement. And Dr. White, again, I know I've heard you say similar things.
Correct. So I just wanted to go back. I had another question that had been submitted that I forgot to get to. And it was just, again, kind of centering around if it's near for sure that all districts are going to begin the year on NTI and work towards being back in person, kind of like what KSB and KSD are going to be doing. When might the commissioner or governor make that decision, and will it be an order or will it be a recommendation? Because sooner versus later would making multiple plans is difficult for them to manage.
Are they talking about an additional recommendation in mid-August for mid-August forward if we don't see a reduction?
I believe so. Yeah, just when, and I think you had talked earlier about 2-week intervals and stuff, but I think they're just wanting to know when. Yes.
Yeah, and that's a difficult question to answer, because we want to allow enough time to show a decrease in cases at the same time, we know you need the time to plan. And so roughly 2 weeks from now, or a little over 2 weeks from now, we hit mid-August, and we're thinking that it could take 2 weeks to start seeing the numbers go down. So when you put that out on a calendar, that may not give you a lot of notice. But you're going to obviously be watching the numbers every day, and you'll know. It's no secret what the numbers are every day, and so you'll know whether we're seeing a decrease or not. So we'll have some indicators along the way. And as far as being an order versus a recommendation, I think the governor has taken pride in the fact, and I have taken pride in the fact, that all of the school closures, the going to complete NTI, all that was done on a recommendation of the governor. And as I've said before, that is a testament to Kentuckians, the school community, superintendents, local boards of education, how we operate as a state. And that doesn't mean we don't disagree with each other. We're a family, and families disagree too. That mean we always like each other, but I believe we truly have acted as a family and as a unit, trying to do the best thing for our state and our kids. And that's why the governor's been able to have recommendations for education-related issues and not orders, as other states have had to do. And my guess is he would want to continue down that same path.
Okay, and I think that's it for the questions. And we're right about 5 minutes early today. So
I want to thank everyone. As I've reiterated to you, Dr. Glass is already engaged in the work here. He is, of course, still in Denver and will be finishing the school year out there, as his contract requires him to do, and they wanted him to open school there, and we completely understand why. However, he is already engaged here. I have daily conversations with him, and he is excited and has asked me to send messages to the superintendents as he's excited to interact and meet and talk with each one of you. And so I know you're looking forward to that. And he will be on the ground full-time September 14th, and then we will be able to have him a few days in August to start. We're already started the transition, but to have additional transition activity. So I just want to give you that brief update. Thank all of you for the work you're doing under very, very difficult circumstances. Feel free to reach out to me through text or email if you have any individual concerns. Thank you.
Just a second. I'm getting a text from Kelly right now from the governor's office, so I may be able to answer your question.
Okay, great.
I'm waiting for the 3 little dots. They're going. Apologize, but I thought I'd rather hijack your call if I can give you an answer right now rather than people have to wait. So it appears that when the governor was talking about no classes for 2 weeks, he was referring to starting up new classes. So it appears that if a remedial class is ongoing and this is small numbers and all the guidelines are being followed, it's best if it could be virtual. But if you're following all the guidelines and the healthy at school, then that kind of a program can be continued.
okay.
So, Dr. White, this is Kelly. Not to make this more complicated, but I know the specific question that I received today was not about one that is currently happening. It was about one that they were planning to start, in the first couple of weeks of August. So I don't know if you can clarify that now. It sounds like to me that you're saying if it's been happening over the summer, it's okay to continue, but if it's a new program, there shouldn't be any new face-to-face education happening until the 3rd week of August.
That is correct.
Thank you.
Okay. Well, thank you for getting that answered for us there, Dr. White. Very efficient. And we're still 3 minutes early.